Hello and welcome to the ComForConnections podcast. In this episode, best practice considerations for aging services pros, end-of-life care planning, we are joined by Karen Faith Gordon of Karen Faith LLC. Listen in as we discuss the importance of end-of-life care planning and how aging services professionals can help patients and family members through this process. Stay tuned for expert insights and practical tips to elevate your practice in serving aging populations. Welcome, Karen. It's a pleasure to speak with you today.
Thank you, Tiffany.
Karen, can you tell our listeners about Karen Faith LLC and how its services support clients on their aging journey?
Sure, thanks. Karen Faith LLC, that's me, Karen Faith Gordon. I'm a licensed clinical social worker. I have a mental health practice which focuses on the transitions that happen within the realm of aging, typically post age 50, and it can include a variety of topics from retirement to moving to a diagnosis to a decline to end of life and grief and loss and everything in between.
What a wonderful way to help individuals age with confidence. As we remain on the topic of the aging journey, can you elaborate on end-of-life care, what it is, and how aging services professionals can help their clients through this process?
What I see most often in my practice with people who are moving through a change, and whether it be end of life or something that just looks like a change fundamentally in their life because of a diagnosis, we're looking at mortality. And so we're always looking at eventually there is going to be end of life, and this journey is finite. And what does that look like? And how does each individual respond to that conversation? And as an aging life professional, I find that it's our job, if you will, it's my calling for me personally to hold space for those conversations such that people can be with the emotions that are coming up during those trying moments and challenging times and be present to the situation without feeling overwhelmed by it, because most of the time people are perceiving chaos and a lot of noise. And from that space, it's very challenging, if not, it might feel impossible to make decisions in those moments. And so for those of us who are here to guide those conversations, it is upon us to support them in finding their center, in finding the calm that will allow them to make decisions that feel supportive to them.
Thank you, Karen, for sharing your approach with our listeners and your passion. Can you share the options for end-of-life care that are available and how aging services professionals can help clients determine the best option for their needs?
Well, we like to talk about what are the needs currently when we're meeting with a family or an individual, and what are the needs expected, what are the expectations moving forward? We don't have a crystal ball, so within the best of our knowledge, what does the diagnosis dictate is going to likely happen, and how can we create a roadmap for that person so that they have the infrastructure that's needed to be supported throughout that journey? If someone's living at home, it means that we're assessing the home, and is it safe? Is it secure? Are they going to be able to manage and sustain their independence in that setting? If the answer is no, then we're looking at what does a more supportive community look like. Typically, that would be something, maybe assisted living, maybe memory care, maybe a small group home. We want to be sure that the questions are asked so that when the decision is made, there's a confidence with that decision and the family can move forward feeling empowered. And of course, hospice is a conversation that I invite families to very gently, because we, again, as professionals who are in the arena, must be very aware of our audience, meaning that I've reminded myself internally over time that not everybody is talking about death and dying every day, and that when I, am ready to have a conversation about hospice, the person sitting across from me might have a completely different definition in their own mind of what hospice is. And if I'm not careful, it's upon me to be mindful of that person's perspective such that I approach the topic gently and with sensitivity to be able to convey to them what hospice is and what it is not, so that any fear or anxiety they have around that topic can hopefully be alleviated.
Given the numerous ways end-of-life care can be supported, what considerations should aging services professionals have in mind when discussing end-of-life care planning with their clients, especially with regard to individuals who can't self-advocate due to disability or another physical condition?
That's a very good point. Thank you for raising that. I spent part of my career as a care manager, and that role involved patient advocacy, care coordination, and basically being the boots on the ground for anything that would come up for someone who, as you said, let's call them, there's a growing number of people who are considered solo agers, people who don't have the infrastructure or necessarily the village there to support them as decline might set in. And in those cases, I would argue that the most valuable piece to that puzzle for that person is a care manager who is a professional social worker or nurse who can come in and be ready to advocate for the person's physical needs, mental needs, housing needs, everything that would affect the person's well-being so that they have optimal quality of life and dignity through whatever their end-of-life journey looks like. Those needs are met appropriately when there is a voice to speak for them if they are unable to speak for themselves.
It's very important to be able to support everyone's aging journey. Thank you, Karen, for sharing these insights. Let's transition this conversation a bit and focus on a topic that, while being extremely important, is sometimes left as an afterthought: grief counseling. Could you share with us what grief counseling is, its benefits, and who should pursue it?
This is a big one for me because grief counseling is a critical component to the conversation. And to your point, it often gets overlooked because culturally, we do ourselves a disservice when we see death as a concrete construct. Something or someone dies and then we grieve. And while that is true, there is anticipatory grief and ambiguous grief. There is these are the sort of subcategories of grief that are disenfranchised in our society. We don't talk about them. So you can look at when someone can't drive anymore, or they move from their family home, or they no longer have the same role or purpose in their life. Getting up in the morning there's a very different why we're waking up every day when our role and our purpose has changed so dramatically from whatever drove us to move through every day of our life as adults. And so I really encourage families and individuals to open their minds a bit more to include in this grief narrative the multiple losses that get to be processed and looked at as we move through this journey of change and transition throughout the aging process.
Karen, can you share a few tips and resources for aging services professionals who are helping clients with end-of-life care decisions?
Yes, there is a website by David Kessler, who studied under Elizabeth Kubler-Ross, who is the person who developed the stages of grief years and years ago. And his name is David Kessler, and the website is called grief.com. I find that to have enormous amount of content. It's expansive in its reach in terms of the content and the capacity for people to interface with others who are on a journey that can look so many different ways, and yet there's so much affirmation to be found when you find yourself in a forum where others are coming to a space and you're learning that, in fact, you, as alone as a person may feel, there's so much affirmation in knowing that someone else is experiencing a similar journey and they can learn so much from them. There's also a site called daughterhood.org that I have found very valuable.
Thank you, Karen. It's so important for people to know where to go for information and also be connected with others. Like you said, there's a forum. You can be connected with others going through something similar. Before we reach the end of our episode, do you have any additional thoughts you'd like to share with our listeners?
Again, for me, it circles back to the affirmation of the experience. None of us is exempt from aging. I mean, if we're here, we're aging. And I really hear so often people say to me that they feel so alone. They feel like no one else could ever understand what they're going through. And while I agree that each of our individual experiences are just that, they're individual and nuanced to our own circumstances, collectively, there is so much rich space to engage and connect and support each other through the interface that we can do and through this means of communication that allows us to affirm our experience and know that, in fact, that sense of aloneness can dissipate even just a little bit and give us a sense of being on a path with others that feels strengthening and, really helps our resilience on the journey.
Karen, you're right. We will all go through this aging process. We aren't alone. The work you do is so important, and I appreciate you sharing your knowledge with me as well as our listeners today. So thank you so much again for joining us and sharing your insightful thoughts with our listeners.
Thank you so much for having me. I appreciate the time. Thank you, Tiffany.
Listeners, to view resources, show notes, and access more ComForConnections episodes, visit ComForConnections.com. You can also subscribe and listen to our podcast on your favorite app. Thank you for listening and helping older adults live their best life possible.